I would say, at least at CareSource, we don't rely necessarily on these value assessment frameworks at this time. They're just a new tool in the bucket of tools that we have. They are important because they do help us assess whether the cost might be appropriate or not, but we have little influence on whether we're going to get that cost lowered or not based on these tools at this time. So we use them in a way that just is another piece in our sort of checklist of things that we can say, hey, did we collect all the evidence we need to make a recommendation on how we manage this drug? For some payers, I'd say they might rely more heavily on them than we do. We do have a couple of teams at CareSource that look at either the clinical or the financial economic piece of the puzzle in making a decision. So we use them probably just to say, hey, did we collect all that information? Did we check all the boxes? Are we presenting the right information to our committees that we're gonna make those recommendations and they're gonna either accept or reject those recommendations on how we manage drugs. So for us, it's sort of in that informal piece of a checklist that we've developed for our population. As far as pricing negotiations, not heavily reliant on that at this point, but I think as we continue to move to this pay for performance and value-based payment model, they'll become more and more important as more and more tools are available. I think for managed care pharmacists, it's really important to understand that these tools are available out there because everyone's pressed for time and resources. So it is a place that you can make sure you've got all the organized information that's available about a treatment and what the quality of that evidence is. And that helps us to make a very informed decision, to look at the totality of evidence and say, this is how a drug, yes, this is exactly how it should be used, this is the right population, this is the right patient type, so that we place the drug in a place on our formulary and have criteria that make it appropriate for use, so that we're not having an added burden to providers who are prescribing the drug, but also making sure that we're having appropriate access for patients and not delaying care when appropriate. I think the strengths of these value assessment frameworks are that we're talking about them so much now. It's become something in the last several years that's getting a lot of attention. So there's more attention to what tools are out there, what tools are not out there, how are they looking at the evidence? It's an organized way that each tool is following so that everyone understands the methodology and how they're calculating whatever they determine that value is. I think for CareSource, the biggest limitation now is there's not a value assessment for every drug. So we are still making our own value assessments, and that's why these tools are just one piece in the bucket. And then the other thing that I would say is a limitation is that they don't necessarily look at the subpopulation. So CareSource, we're in regulated programs, so one of our biggest markets is Medicaid, and these value assessment frameworks don't necessarily take into account things that a Medicaid patient might face that we have to consider when making a decision.